Community Volunteers in Medicine, in collaboration with Chester County Hospital, was able to do lab tests, ultrasounds, a biopsy, a life-saving surgery, and now ongoing radiation treatment for my patient Veronica.
The first thing I want you to know is that I suffer, and I do mean suffer, from severe social anxiety. So standing here before you today is extraordinarily difficult for me. Only something monumental could persuade me to leave my comfort zone, and that something is how strongly I feel about the work done at CVIM. I lost my health insurance when the downturn in the economy affected the bottom line at the company I work for. The company budget was slashed, and one of the items lost was health care, and I could not afford COBRA. It was at this time that I heard about CVIM from a neighbor and qualified to be accepted as a patient. Early in 2012, CVIM scheduled me for a routine mammogram when the Fox Chase mobile mammogram van was at the clinic. The results indicated an unusual mass. With no insurance, CVIM arranged for me to go to the Chester County Hospital for additional testing and ultimately a biopsy. Fortunately, the results revealed it was non-cancerous. Over the next year, I had appointments with several doctors at CVIM, including gynecologist Dr. Maury Gold, who scheduled me for pap smears, ultrasounds, and MRI, and recommended I have a hysteroscopy. During the same time, the CVIM nurses reminded me that it was time for my annual mammogram, which once again showed a suspicious area. And again, it was CVIM that arranged for ultrasounds and biopsy at the Chester County Hospital. I remember going numb when I was told that I had breast cancer. My brain seemed to disengage, and I was overwhelmed with the number of tests I had to undergo and the speed at which they were being scheduled. To the great credit of CVIM and the Chester County Hospital, my breast surgery with Dr. Rhodes and the hysteroscopy with Dr. Gold were coordinated to take place at the same time. On March 20th, 2013, I had a lumpectomy performed on my left breast, along with lymph nodes removed and uterine polyps removed, which thankfully were benign. But the efforts of CVIM and the Chester County Hospital did not stop then. They have both provided me with surgical aftercare and follow-up appointments and treatment. Today, 3 months later, I am nearing the end of my radiation treatment for breast cancer. I am keenly aware of how extremely fortunate I am. Throughout this process, I have received superior health care from CVIM and the Chester County Hospital. Had it not been for those facilities and staff members, my tumor would never have been discovered. As it is, I not only still have my breast, but I also have my life. And for that, my appreciation is profound and my gratitude is immeasurable. My sincerest thanks to Community Volunteers in Medicine and the Chester County Hospital. And thank you to everyone for your support here today, for CVM and all that they do for countless people just like me.